Hemiglossectomy. You must have had times when you tried to say a 5-syllable word and it took you 7 syllables to get there. Yeah, it's humiliating. Even if you were a chronic stutterer, you still wouldn't take out your tongue because you talk differently, right? These days, you probably wouldn't do that. But between the 18th and 19th centuries, if you were caught stammering, the physicians of those days had an extreme solution for your little speech impediment. Say you're a royal messenger in 1745. You deliver a message from the next kingdom to your mad king. But because you know he won't like the news you brought, you begin to stutter out of fear. And somewhere in your scattered brain, you call the king's mother an asshole when you meant to say kind soul. And after talking yourself into a beheading, the angry king immediately summons the executioner. But being a truly kind soul, the king's mother makes him realize that you've just got the stutter. So the king's physician replaces the executioner. If this had happened late in the 19th century, you might have gotten some opium to ease the pain, but this was the wrong century for anesthesia, so the physician begins the harrowing process of curing your stutter with all your senses intact. As he opens his toolbox, you try to tell him you're not really a stutterer, but every word that comes out of your anxious mouth sounds like a bad DJ scratch. Hey, Doc, can we put this off for a while? I swear, I'm not a stutterer, man. Can you hear yourself right now? I'm not a stutterer, man. I think you're also suffering from delusion. I might have to open your brain first. Hey, Doc, you don't have to do this. The delusion is gone. Just take a tongue and leave the brain, please. Wow. Write this down immediately. Fear cures delusion. Yes, it does. Open your mouth now. So the doctor clasps your tongue between a pair of forceps and yanks the pink thing out of your mouth. Then he pulls out a pair of scissors that still has a bit of its last victim's blood on it. He tests the blade with a diabolical shearing action that makes you gnash your teeth so hard you bite your tongue. He thanks you for helping him mark the middle of your tongue and cuts through it like a hot knife through butter. And when he's done, you howl and splash blood all over your chest and breeches. You look like you've been eating yourself from the inside. But while you only have to worry about not being able to eat your wife's pudenda anymore, some people actually bled to death from losing half of their tongue, as you just did. Also, just in case you haven't figured it out already, that never worked. That's why doctors only cut tongues now in case of oral cancer or for cosmetic reasons. B tier. Xenotransplantation. Xeno means foreign. Add that to transplantation and you're transferring body parts from one animal species into a totally different one. When this procedure got popular in the 20th century, some doctors actually swore they could cure impotence and every kind of male weakness with it. Xenotransplantation became a craze in the early 20th century thanks to Sergei Voronov in France and John R. Brinkley in the United States. Around the late 1910s, these boys developed a pretty bizarre hobby. They started transplanting testicular cells from young animals into older ones. John probably learned about this practice from Sergei's work since John was the quack. Actually, they were both charlatans. Sergei just had a legitimate medical certificate while John bought his degree from a diploma black market. At first, Sergei was taking testicles from executed criminals and putting them in millionaires. But that ended when France's low execution rate couldn't support the demand for his crooked balls. So he switched to chimpanzees. Meanwhile, on the other side of the world, John was working with goats. And after falsely reporting his success in hundreds of animal experiments, Sergei moved on to humans in 1920. He opened up a young chimpanzee's ball sack and cut thin slices of its testicles. Then he attached them to an 80-year-old man's testicles, and some months later, according to Sergei, the man could take on a prime Mike Tyson in a boxing ring and win. John, on the other hand, paid an old man to take his goat balls so he could prove his theory that goat testicles increase male virility. If you know rich people, then you know they love their ball bags. Maybe not as big as a goat's, but just big enough to make them feel like the goat. So business was booming on both sides. John kept most of his operations in Kansas, mostly because the American Medical Association was hot on his tail. But Sergei had a customer base so global that people were getting his chimpanzee balls in faraway Algeria. The demand for his chimpanzee cojones was so high that he had to build his own monkey farm to cultivate them. Did you see them taking Rob last night? Yeah, I did. What do you think they'll do to him? I heard he's going to auction for a big Hollywood movie. Thanks for your balls, bro. As incredible as it sounds, this con ran for almost 2 decades before Sergei's lies were exposed. And around the same time, a mob of people and institutions were trying to hang John for his crimes in the US. Now, just so you don't say, oh, these awful men did nothing for women, you should know that Sergei also put chimpanzee ovaries in women, and John fixed some women up with goat eggs. Now, put these sick fucks on S tier. Lithotomy. Things can get weird really fast when there's a stone in your kidney, your bladder, or your gallbladder, because the human wiener, for the most part, is simply a jizz and urine dispenser. It's just not designed to pee stones, except if you're a geologist, of course. This was why some physicians developed and specialized in lithotomy to remove these stones as far back as ancient Egypt. In 13th century France, for example, if you were finding it hard to pee and your village physician figured a stone was blocking your pee hole, you'd have to get the nearest lithotomist to help with that. Those guys never stayed in a place for a long time, so if you're in luck, you'd find one on his way to the next town. Hey, Monsieur Marshal, stop! Why have you been chasing my cart like a robber? My God, I thought this was an ambush. Actually, it is. My ex-wife's husband needs a lithotomy and you'll give it to him. Your ex-wife's husband? Yeah, he's also my distant cousin. It's a long story. To start this procedure, the doctor will place you on a lithotomy table and put you in the lithotomy position. So you're laid on a table and with your knees bent, your legs are raised above your hips and held apart by stirrups to reveal your frightened butthole to the physician. All the while, some villagers will be around cheering you on. Also, remember, no anesthesia. So on a pain scale from 1 to 10, this is going to be an 11. The doctor starts the surgery by making a slit in the space between your butthole and your ball sack. Then he gets dilators to keep the cut open so he can probe your organs for the stone. He'll feel his way around your insides with this thin rod called a lithotome until he hits the hard foreign object. When he finds it, he'll hold it in place and insert a blunt instrument through the same hole to break the stone into little pieces as you grunt and beg for it to end. Then he'll remove the broken stones one after the other with a hook, and by the time he removes the last one and shows it to the crowd, you'd have been in the lithotomy position for several agonizing hours. Then he'll send you home with a sore ass and hope your body heals well. But the fact that the stone is gone doesn't mean you're off the hook. Lithotomies often caused serious inflammations and infections that led to death because they never cleaned their tools. That could explain why your ancestors believed in God so much back then. B tier. Anal fistula surgery. After devouring a huge bucket of chicken nuggets at an eating competition, you end up in the toilet, and you pay for your gluttony with a big log of shit that rips your butthole. You think the tear is just gonna heal and you'll return to your gluttonous life, but it gets infected. And 2 weeks later, you wake up and find a tube has grown in your asshole and it's leaking blood and pus onto the mouth of your anus. Now that's an anal fistula. This little tube can make life difficult for you if you ignore it. Apart from the awful smell of the discharges, you'll find it hard to walk, sit, cough, or take a shit. Because this weird tube will assault your anus with a constant throbbing pain. Why are you walking weird, man? I've got this tunnel in my butt and it's been leaking all kinds of stuff and it hurts like crazy. I'm going to see the doctor about it today. So if I give you a wedgie right now, it's gonna hurt like hell? Yeah? Wedgie time! Oh, f*** you, Brandon! Anal fistulas are ordinarily painful, so when no anesthesia, medieval physicians tried to remove them, it was a ride on the pain train. For maximum access to your butthole, they'll put you in the lithotomy position, they'll widen the butthole with a speculum, and slowly they'll shave this tube with a sharp blade. They'll peel off this vessel to release the stinky mixture of blood, mucus, and pus, and when they are sure they've gotten all of it, they'll stuff your bleeding asshole with absorbent materials to stop the bleeding. You'll remain on the bed until your asshole heals, but due to the crude tools they use, you may have suffered for nothing because the fistula may still be there. Or even worse, the doctor may have created a new one if your anus gets infected. D tier. Amputation. Have you ever wondered what it felt like to sever a limb pre-anesthesia? Well, in case that has been keeping you up at night, all you need to know is it was nasty stuff. The year is 400 BC, and you're walking back home from your mistress's house. But no one gives an emperor's scrotum about that since everyone slept with everyone in Rome. However, it's too dark to see a stone in the middle of the road, and you're too drunk to react correctly as you fall off your horse. You land awkwardly on your foot and hear a loud crack. Your leg's broken, and you scream from the pain that instantly courses through your body as you lie on the quiet road. Fortunately for you, a stranger on horseback saves you by giving you a lift home, but you cry the whole way because every time the horse gallops, it grates your fractured bones against each other. Hey man, can you make the horse go a little slower? It's messing up my leg. Are you in some kind of pain? What? You know my leg is broken, right? Yeah, but my heart also breaks every time you my woman while I'm away. Are you Brutus the Crazy? Yes, I am. And it's so nice to meet you. Faster! Yeah! The next morning, a physician's apprentice comes to reset the broken bone, and you feel every bit of the pain because all you had for anesthesia was some of the same wine that put you in this position. But 3 days later, you notice the flesh around the fracture site has turned purple and it smells like rotten meat. So the apprentice returns, this time with the physician and his bone saw. The apprentice and your oldest son hold your hands to stop you from flailing around like a chicken, and instead of helping you feel less pain, the alcohol only amplifies it, so you hear your muscles snapping off as the saw tears your skin. To make matters worse, the stupid surgeon forgot to sharpen his saw, so instead of 5 minutes, he spends 10 extra minutes cutting off your bone. When the bone finally comes off, he ties your blood vessels to stop them from shooting off all your blood. Then he rolls a red-hot rod over the wound until the blood stops dripping, but by then you are dead from all the pain. S tier. Tooth extraction. People used to clean their teeth with weird stuff like charcoal, oyster shells, and crushed bones. So it made sense that once in a while they needed to pull out a rotten tooth. Some people even stopped brushing their teeth after one Pierre Frouchard told them to. And those who believe this French fraud had an even higher chance of ending up in the barber's chair, just not for a haircut. The practice makes zero sense today, but back then barbers doubled as surgeons too. So you go to your barber surgeon to remove a tooth that's become a source of unbearable pain. He preps you by telling you to open your mouth. No anesthetic, no calming flute music to take your mind off the pain. He just begins pulling the tooth with a plier-like tool. However, the tooth is a molar, and since you won't keep your mouth open, he takes about 30 minutes to pull it out, and every one of those minutes feels like your last. Even when it eventually comes off, you don't feel instant relief. Instead, you feel a replacement pain. The uprooting of that tooth tears a chunk of your gum with it and destroys the tissues surrounding the tooth, so your mouth looks like you enjoy eating rabbits raw. C tier. Cancer surgery. For most of human history, a cancer diagnosis has been equal to a death sentence. But way before modern doctors came up with chemotherapy and stem cell transplants, ancient surgeons were already battling these stubborn cells. Even after two of the wisest surgeons from the classic era told the surgeons to leave cancer alone, some patients still chose surgery over the idea of an unavoidable death. However, cancer treatment was at its worst in ancient Egypt when the Egyptians used something called a fire drill to remove cancerous cells. Imagine you're a physician in ancient Egypt with zero knowledge of anesthesia, but there's a large tumor lodged deep within your patient's belly and he wants you to remove it. So you make an equally large incision with a contaminated scalpel and open the belly to the wind. Meanwhile, the patient is in so much agony that he can sense he's dying. Then you pull a fire drill out of a nearby fire, and you can see your patient shivering as the glowing red metal approaches his exposed internal organs. Yeah, bring it on! I want all the smoke! I'll be back. The overwhelming smell of burning tissues hits your nostrils as you roll the rod around the tumor to burn it off. Then you close the stomach and pray to the god of medicine to heal the wound. Most deaths from this surgery happened during the procedure, and this was why most people in the Dark Ages chose to die with their conditions. Surgeries back then were just medical executions. Let's put this on S tier and get out of here.